I like the lack of moisture that builds up. I like the light that I can see everything perfectly. I like the retraction so nothing's in my way.
It makes my life so much easier. The ability to have access, the ability to have visibility, to see what I'm doing, the ability to have total retraction of cheek and tongue, suction, a dry environment. It allows me to prepare better, it allows me to insert better, cement better, and it allows the patient to have a more positive patient experience.
At Isolite Systems, we believe better isolation equals better dentistry. Better isolation means faster, safer, more comfortable procedures for you and your patients. Less neck and back pain, and less chair time per patient so that you can grow your practice. When you really think about standard forehand dentistry, a number of challenges emerge. The tongue is in the way, hands are in the way, suction is in the way. Patients need to be repositioned for better access or visibility, overhead lights need to be adjusted, moisture builds up from the breath, and saliva continuously soaks cotton rolls, which need to be changed, adding time to each procedure. These challenges led Dr. Thomas Hirsch to rethink dental isolation and invent the Isolite Dry Field Illuminator, a technology breakthrough that delivers illumination, hands-free evacuation, and retraction all in one easy-to-use device.
This paradigm shift in isolation, combined with an ergonomic design that reduces fatigue and repetitive stress associated with retraction, suctioning, or otherwise repositioning the patient, has resulted in several industry accolades since Isolite was launched. Dentists using Isolite are reducing procedure times by 20 to 30%, making the entire practice more productive and profitable. At the heart of the Isolite system is the unique patented Isolite mouthpiece. The soft, flexible, non-impinging Isolite mouthpiece isolates upper and lower quadrants simultaneously, retracts and protects tongue and cheek, delivers bright, shadowless illumination throughout the oral cavity, continuously evacuates fluids and oral debris, and obturates the throat to prevent inadvertent aspiration of material. Easy to place and comfortable for the patient, the Isolite mouthpiece can be placed in only a few seconds and removed even more quickly. Economical, single-use mouthpieces mean no risk of patient cross-contamination. By inserting the soft Isolite mouthpiece, immediate tongue and cheek retraction and protection are accomplished. The tongue is completely out of the way, no more fighting it throughout the procedure. In addition, with the Isolite mouthpiece serving as a barrier, the airway is protected from inadvertent aspiration of drop material. With Isolite, evacuation of the oral cavity and oral humidity control are so complete that testing demonstrated that isolation accomplished via Isolite is as dry or drier than a rubber dam. Continuous suction provided by Isolite reduces airborne aerosols and reduces mirror fogging. By lighting the patient's oral cavity from within the mouth, Isolite provides a unique shadowless illumination solution that benefits both practitioner and patient. Unlike conventional lighting, light emanating from the Isolite mouthpiece cannot be blocked by practitioner's head or hands. Clear, bright illumination reduces eye strain for the practitioner and diminishes light shining in the patient's eyes. With Isolite, patients don't have to strain to keep their mouth open the entire procedure. The built-in bite block allows the patient to comfortably rest their jaw while keeping their mouth open at all times. The pairing of tongue and cheek retraction and bite block with continuous aspiration provides the dental professional uninterrupted access to an entire quadrant.
I found Isolite has made my day a lot easier because it's quicker. You can, get through procedures a lot faster and, saves the patient time and me time.
My patients really enjoy Isolite. They enjoy the fact that there's no saliva or water building up in the back of their mouth. They don't have to worry about where their tongue and cheek are, so they're much more comfortable.
They want it again because they understand that it's a more comfortable procedure for them and it enables me to do the best work I can do.
Actually, this is the second time that they've used Isolite here. The first time was with my tooth cleaning, and what I noticed then and I noticed today is that It's much more comfortable to be in the chair. I don't have to worry about, is my mouth open far enough? I don't have to worry about my tongue always getting in the way. It makes it much easier to just relax and allow the dental work to go more smoothly.
It was really comfortable, and it stopped all the water from going to the back of my throat.
My patients respond to the Isolite very well. Sometimes when we have a new patient, what I'll do is I'll introduce it to them, let them touch it, feel it, explain exactly how it's used. We'll try it in, make sure it's comfortable. And some will just, when they come in the next time, they'll just ask for it, are we going to be able to use that mouth thing, that thing that glows? And we'll say, yes, we absolutely are. And we'll place it in for them, and they just sit back, relax, and have a great time.
Let's take a quick look at how Isolite works. A single line provides both power and vacuum to the device. A single-use mouthpiece is attached to the device and inserted into the patient's mouth. Light pours in and fills the oral cavity, while fluid and debris flow out through 2 vacuum channels in the Isolite mouthpiece. Fingertip controls allow for precise control of vacuum strength in upper or lower quadrant. And the built-in bite block allows the patient to comfortably rest their jaw while keeping the mouth open at all times. The award-winning design of the patented Isolite mouthpiece is the heart of the Isolite system and is the point at which illumination, isolation, and aspiration converge. Mouthpieces are constructed of Isoflex, a soft, flexible polymer, and are available in 4 sizes: adult small, adult medium, adult large, and pediatric. The integrated bite block is soft and comfortable to the patient. The bite block accommodates anterior and posterior positioning, putting you in full control of the working area. Tired of fighting the strongest muscle in the body? The Isolite mouthpiece has built-in flexible tongue and cheek protection. The tongue retractor and cheek shield are specifically designed to create both a perceived and actual safe zone for the patient's tongue. Now you can work behind the most posterior maxillary molar without injuring the cheek or fighting the tongue. The bilaterally symmetrical design allows the mouthpiece to be utilized on either side of the patient's mouth, illuminating, isolating, and aspirating upper and lower, right or left quadrants. Economical, single-use mouthpieces mean no risk of patient cross-contamination and effective compliance with infection control protocol. The Isolite Dry Field Illuminator is a state-of-the-art isolation solution for the modern dental practice. Using the Isolite system, dentists and their staff members can significantly reduce procedure times while improving patient comfort, staff ergonomics, and practice productivity. Isolite is indicated for any restorative or hygiene procedure where maintaining a clear, dry, well-lit field is advantageous. It is an excellent alternative to the rubber dam, requires no anesthesia, is easier to place, and is more comfortable for the patient.
I use Isolite for crown bridges, prep, and also majority is for fillings.
When I started using CEREC, it sort of went so hand in hand from everyone I had spoke to before me. They said, you got to try it. I put the first one in and it was done from there. I'd never looked back.
Absolutely everything. We use it for crown and bridge, we use it for implants, we use it for our seating, our cases. Just the other day we actually did, it was just yesterday as a matter of fact, we did an implant case. And those parts are so tiny that you have to make sure that the patient's protected, that no one swallows them. And we went ahead and placed our implant, and it just so happened, sometimes the doctor's fingers are a little bit big, and when you place it in, it doesn't quite go in like you want it, and it may fall to their side, to the side of their tongue, and the Isolite was there to catch it. It was fabulous.
The thing I like best about the Isolite system is if for some reason I have to get up and grab something or do something in the next room, I know that he's okay. I know that he's able to work without me.
Anyone that knows me and knows that I write on technology, I always write about the technology, what it does, and what is the ROI, return on investment. The return on investment is huge with Isolite. And first of all, I don't think it's very costly. It's extremely cost effective. Dentistry is all about relationships. And if I can improve my relationship with my patient by providing excellent dentistry and excellent service and patient comfort, well, that return on investment is priceless.
At Isolite, we believe that better isolation results in better dentistry. Our mission is to give dental professionals the tools to achieve and maintain the very best isolation quickly, easily, and comfortably, while improving patient safety and comfort. Dental professionals using the Isolite system benefit from faster procedures, better visibility, greater access and more working room, improved isolation and moisture control, and greater patient comfort and safety. If you'd like to learn more about how Isolite can benefit your practice, we invite you to call or visit us on the web